Hello and welcome to Policymakers. My name is Tom Cross, and we have a very interesting and, for that matter, fascinating topic we're going to talk about today, and that's diabetes. And joining me in our first segment is Peggy Hasenauer, the Executive Director at the University of Chicago's Diabetes
Kovler
Center.
Diabetes Center.
Kovler, I always try Kovler. Peggy, you are, University of Chicago has a pretty state-of-the-art, very proactive center with Kovler. And tell us a little bit about it and your role there.
Sure. So my role as Executive Director of the Kovler Diabetes Center is to really bring together the best of the best. So researchers, scientists, clinicians, we have a phenomenal program and an infrastructure at U of C that really involves over 150 scientists and clinicians, all working toward better management of diabetes, research looking at complications, and better care and education for individuals who are dealing with diabetes. So my role really is looking at the clinical aspects of our care that we provide, ensuring that families receive what they need, doing community outreach. As a nurse by trade, my first and foremost responsibility is to the patients we care for and their families, but it's been a phenomenal role and an exciting ride the last few years.
I want to back up a little bit. I want to talk a little bit more about how you got there, but I don't know that everybody knows what diabetes is, and I do, because I have a daughter with type 1, but there's type 1, there's type 2. Why don't you explain to people a little bit about the difference, and actually there, at least with type 2, there's a growth of that around the country.
Absolutely. We have seen in the United States a huge increase over the last 10 years in the number of individuals with diabetes. I believe at this point there's over 22 million people in the U.S. with both type 1 and type 2 diabetes. Of that 22 million, about 2 million of those have type 1. The greater incidence we're seeing and the greater rise is in individuals with type 2. So what is type 1 and type 2 diabetes? Individuals with type 1 diabetes develop at some point difficulty where their pancreas is no longer producing insulin at all. And there may be some different causes to that, and we're researching that and looking into that. Generally speaking, people who have type 1 diabetes are diagnosed at an early age, although we're seeing many individuals in their 20s and even in their 30s being diagnosed with type 1 diabetes, again meaning that their pancreas produces no insulin at all and they're dependent on insulin every day. Type 2 diabetes is a little different in that people have trouble with their pancreas such that their pancreas is not producing enough insulin or their body's not utilizing the insulin properly. So some individuals can manage their type 2 diabetes with exercise and diet. Others may need some medication to help their body utilize insulin properly. And some others still with type 2 may be on insulin itself. So there's several different treatments for type 2 diabetes depending on the individual's needs. With type 1 diabetes, those individuals are completely dependent on insulin injections.
And I think, so again, so people have an understanding, you hear type 1 also is referred to as juvenile diabetes.
Sure.
That was the kind of the original term.
Right,
like
and we're moving away from that.
Yeah, because you do, we have some friends who were, I think the young man was in his mid to late 20s when he was diagnosed.
Absolutely.
And that's not uncommon now, is it?
It's not, and in fact, at the University of Chicago, Dr. Phillipson and many of the other scientists and physicians were recognizing that there are individuals that come to us that may not necessarily fit the mold for type 1 or type 2 diabetes, depending on their ethnicity or their background or their family history or their genetic makeup. We're recognizing our unique ability as a center to diagnose individuals based on their unique makeup, their unique genetic makeup and their family history.
So and I think the other thing that people may not know, on type 1, as a general rule, you don't outgrow type 1. You can't take a pill. You're seeing people taking a shot, or they have what's known as an insulin pump.
Absolutely.
And now let's talk about type 2 a second. I think historically, when people think about type 2, it's maybe you get a little older, maybe you've gained a little weight, but we're seeing type 2 in young kids now, aren't we?
We are. Unfortunately, as we've seen, the obesity rate in the United States is growing. And we are seeing a huge increase in type 2 diabetes in our younger population, even children as young as 7, 8, 9, and 10. And by and large, that happens because with increased weight, it makes it harder for your pancreas to produce enough insulin to manage all the things that it needs to manage. And so what we see with this adolescent population is a great increase in type 2 diabetes, for which many of those individuals, diet and exercise might bring that diabetes under control. And we're working really hard on programs and services to better that for families and kids.
You know, it's pretty serious. You've got an adolescent with obviously type 1, but someone with type 2, and the long-range complications associated with either type 1 or type 2. If you don't get this under control, and the fact that you could reduce that by a better diet or exercise, could really prevent some significant problems down the road.
Absolutely, absolutely. Some of the research that we'd like to do in the Kovler Diabetes Center in partnership with our community is determining if certain interventions with families and with adolescents with type 2 diabetes, if those interventions actually work and prevent individuals from going into adulthood with problems with obesity and complications related to type 2, because as you've said, the difficulty with diabetes is the management of the complications or the prevention of the complications over time. And so we want to do everything we can to prevent people from having heart problems, kidney problems, and other illnesses related to diabetes.
We're going to talk with Dr. Phillipson. We're going to talk with you some more, but tell us, how did you end up at the Kovler Center?
Sure. So I've been a nurse for almost 15 years. Wow. I have been at the University of Chicago on and off since 1998. I started working with patients in the ICU and on the patient floors, particularly patients with cardiac disease, many of whom had diabetes. And then moved into a role as transplant coordinator for the University of Chicago. And I managed many individuals with diabetes who needed kidney transplants and who needed combined kidney pancreas transplants. So I saw firsthand the real need for management of complications for individuals with diabetes. And then met Dr. Phillipson and started the islet transplant program with him and with Dr. Millis and our surgical team. And then really did some amazing work for a couple of years outside of U of C in insulin pump therapy as a consultant. So it's been a really, really wonderful opportunity, both personally and professionally, to see all the different angles of diabetes and to look at how diabetes not only affects children and adults, but how it affects their families and their loved ones as well.
And we're going to have to take a break, but the Kovler Center is it's kind of like the one-stop shopping place if you've got diabetes.
It really is, and it's for families,
Yeah.
It's for young children, it's for adults, and it's amazing because Dr. Weiss, who is our section chief of both adult and pediatric endocrinology, he really has put together an amazing umbrella of pediatric and adult services.
We've got to take a break.
Sure.
I'm sorry. We're going to be back for a second segment of Policymakers and talking with Dr. Lou Phillipson from the University of Chicago all about diabetes and what's going on, and wonderful things going on at the University of Chicago. We'll be right back.